Hi, Dr. Shook here. Today what I want to talk about is irritable bowel syndrome. It's something that I've written about extensively on my blog, but I constantly get questions and people commenting on some of the posts regarding irritable bowel syndrome, and there's a lot of information online, and it's been written in books. Some of it good, and some of it, not so good in my opinion. And what I wanted to do was to just publish a quick video that would help to explain irritable bowel syndrome and some of the approaches that we take from a functional medicine perspective that looks more at the drivers of the process. So this idea of irritable bowel syndrome is something that I've had since I was about 13 years old, and I think it was actually the cause or the driving factor to other autoimmunity that I've since developed with psoriasis and Hashimoto's euthyroid. So irritable bowel syndrome affects about 60 to 70 million people, and it is one of the most common reasons that people present to their doctor's office is for digestive and problems with their digestion and their bowels. And irritable bowel syndrome is considered a functional bowel problem. So what that means is when they take a scope and they look into your large intestine and they're exploring, they don't see anything. And the reason for that is because there are a lot of drivers or causes of irritable bowel syndrome. Now, a lot of people have irritable bowel syndrome and they have the same symptoms, but they have different drivers or different causes of that process. So some of the most common causes that we see can't be treated with a medication. And that's because people, first of all, they're not being identified. Your doctor just really, from a traditional medical or allopathic approach, they're just not very good at identifying what causes this problem. Again, they're looking in there with a scope, but they're not doing other tests that they should be. And this is 99% of the primary care physicians. They mean well, but they don't know this process of working it up because it doesn't fall within their traditional diagnostic workup. So, for example, one of the most common causes that we see of irritable bowel syndrome are food sensitivities. Now, food sensitivities are different than an allergy. A full-blown allergy is something that causes massive inflammation. It can cause anaphylaxis where your throat swells, your tongue swells, but this is not anaphylaxis. This is actually a food sensitivity. Now, food sensitivity, the most common cause of food sensitivities in the United States is gluten. And gluten is a protein that is in wheat products. So wheat, barley, spelt, rye, a number of foods which are primarily grains and what we think of as our bread, used to produce bread, have gluten in them. And it is a very common allergen that can cause GI inflammation and a lot of the symptoms of irritable bowel syndrome. Now, there are other foods like dairy, for example, and dairy has lactose in it, which is a sugar, and the sugar can actually cause some of the bacteria in your intestinal tract to basically produce gas, and that will cause bloating and distension. But the dairy also has casein in it, and casein is a protein. So the protein in casein can also be inflammatory. So dairy is a common allergen, and then there are a lot of other very common allergens, soy being one of them, and soybean oil is in everything, and it's also in packaged products. But we also have eggs are a very common allergen, corn, and there are a number of other foods that can cause sensitivities. And what we know now and today is that there's really any number of foods that you wouldn't think might cause a sensitivity could be causing you a sensitivity, and primarily because a process like irritable bowel that's caused inflammation with your GI tract, which basically your small intestine and your large intestine has basically set you up for sensitivities to foods that wouldn't normally create a sensitivity. And that's a little bit more than I want to get into on this particular video. So you've got food sensitivities. The other thing is you can have bad bugs or an overgrowth of bad bacteria in your GI tract. And we have a lot of bacteria in our GI tract. There's an estimated 10 trillion bacteria in your colon. And those bacteria, that's more cells than you have in your body. So they make up a very large portion of the DNA that's actually in your body, which is sometimes the estimate is 10 times your own DNA. So these bacteria can get out of balance, and we call that dysbiosis, and that's where you get an overgrowth of bad bacteria, and the good bacteria are less in a ratio. So what ends up happening is when that occurs, you get this, you get a lot of these symptoms of irritable bowel syndrome, and that can cause a fermentation of, again, gases. It can cause, basically what I tell people is this: we keep it real simple. The bad bacteria eat good stuff and poop bad stuff, okay? The good bacteria that you want, they eat bad stuff and poop good stuff, like vitamins and all these byproducts of their activity that are great for your body and your colon and your health. So when that gets out of balance, we can have a lot of problems. Another thing that we can find in the GI tract are parasites. And that's right, a lot of people are kind of surprised when I mention parasites. But parasites are something that we find in people. We find worms and we find different types of parasites. And we do all this where we can work up your gut by doing stool testing. We can actually send a sample to the laboratory and they will analyze it and tell us what's there. Now sometimes you don't have to go that far. Sometimes we can actually treat it and see how you respond if we have an idea of what's going on. But you can, in addition to an imbalance of good and bad bacteria, you can also have a yeast overgrowth. And yeast is something that's very common. It's very common in the GI tract, and it can become overgrown and cause a lot of problems with irritable bowel-like syndromes. So what we do is basically we look at you as a whole, and then we can either do testing, or sometimes we have to do testing, and that's the only option. But we can also use natural protocols that help us, that are antibacterial, antifungal, antiparasitic, and we can use these protocols to try and cleanse and heal the gut. But then what we've got to do is we've got to put good stuff back in there to help to replenish the bacteria, and then after that we follow up with another protocol to actually heal and bring the mucosal lining and the mucus barrier that's there back to health. And that's where, with functional medicine, we look at these drivers or these causes of these processes, and then we work to help you unwind and get healthy naturally. And that's something that, the reason that a lot of your primary care physicians aren't doing that is because, unfortunately, this is something that doesn't fall within their model, and primarily a model that is focused on insurance reimbursement. And here's the thing: there are no codes to bill for this. These appointments take longer than 5 minutes. So the issue becomes that you can't see someone in 5 or 10 minutes and actually help them with these problems. So there's not really a code that you can bill. If you can't keep up with your production in a 5 to 10 minute office visit, then they can't see you or help you. And in addition to that, unfortunately, their training is not focused on looking at these drivers as much as it is dealing with disease processes. Now, let me tell you, your primary care physicians mean very well. I have family members, and I have a lot of good friends that are primary care and that are also specialists, and they mean very well for you. But that's not the system that is best equipped to help with these types of functional problems. And when we're talking about irritable bowel syndrome and autoimmune conditions, this is the realm of where functional medicine really helps people with chronic disease processes to try and nurture them and regain health. So what I want to do is just share this information with you on irritable bowel syndrome, on some of the causes and how we approach it from a functional medicine perspective. It's something that I personally have lived with and that I've helped patients with. So if you're interested, you can go to my blog. It's at drbradshuk.com, and you can learn a lot there by just searching for different blog posts on irritable bowel syndrome. You can also, if you're interested or if you feel like you need some help, you can complete the patient application to see if you're a good fit for our office and if we can work together. But if you have any questions, let me know, and I'll try to elaborate some if I can. But I appreciate you taking time from your day to learn more about your health. Thanks.